Hello, and welcome to Crossing Bridges. Ladies and gentlemen, my guest today is Dr. Victor de los Santos, one of the most renowned dentists in our business today. He was named the top doc by the Top Doc LA magazine in 2011. Dr. de los Santos has 3 offices: Long Beach, Los Angeles, Arcadia, and he has served the San Gabriel Valley in a very positive, effective, satisfied manner for over 25 years. He also provides comprehensive dentistry for you and your families, as well as cosmetic dentistry. Today, I will have the pleasure of speaking with Dr. de los Santos about the proper oral hygiene and why it's important for you to visit your dentist on a regular basis, and other topics that will benefit you immensely so you can have a beautiful smile when you talk to someone. At this time, it is my pleasure to welcome Dr. de los Santos to the show. Dr. de los Santos, thank you for coming on my show. It's delighted to have you.
Well, thank you for having me. It's a pleasure.
As I indicated, you have been so successful because I'm also seeing you firsthand perform on my wife at your office in Arcadia. And testimony after one another has been really positive about you, and people can go on SmileOne.com and see what I'm talking about. But I want today for the viewing audience to have a better understanding why it's so important to have good oral hygiene and why they should visit their dentist on a regular basis. So if you'd be so kind, expand as to why it's important to have a good oral hygiene and what they need to do to maintain that.
Well, in dentistry, it's pretty simple actually, but a lot of people are afraid of going to the dentist because of either a bad experience. But like our overall health, it's important to have proper hygiene and proper nutrition. And like with dentistry, good diet is important, and of course, the oral hygiene. So I tell my patients all the time, you've got to brush and floss after every meal, especially at night, because I see patients, they say, oh, I just do it in the morning. I said, no, you got to do it especially at night. And of course, floss. And diet is so important, from sodas, carbohydrates, everything like that. So it's really important by using your floss.
Now, the standard is brush after each meal. That's all the advertisement and all the dentists tell their patients. Now, there is a proper way of brushing and there's a wrong way. If you be so kind, could you just expand from the standpoint of how to use the brush?
Well, that again is real simple. In the old days, they tell you to brush hard and in circular motion. It's not really like that. A lot of times, even with electric toothbrushes, people have a tendency to brush really hard and aggressive. They're not tiles, so you use a soft toothbrush, brush kind of gently downward away from the gums, and otherwise your gums will recede, which leads to gingival loss. Eventually your teeth get sensitive to cold. And as far as diet, make sure you drink lots of water. Water is important. Avoid sodas. Obviously, once in a while, you don't have to deprive yourself, but a lot of sodas have too many sugars in it.
Right.
One pack of, I tell my patients all the time, one pack is about 1 gram. If you look at a can of soda, it's about 29, 28 grams of sugar.
Well, a lot of people don't realize.
Even 39.
Yeah, they think if you have Diet Coke or Diet Soda, that minimizes problem on your teeth, but that's not right.
No. Water, it's very important to have water.
So it doesn't matter what type of sodas, it really affects. What does it do basically? Does it affect the enamel of the teeth?
Yes, especially it gets stuck in between your teeth and you can't brush it. So that's why it's so important to floss.
And as a result of that, if it gets caught between your teeth, what will happen to your gums?
Well, little by little, when food gets caught and gets trapped there, eventually you get food impaction, which leads to inflamed gums. And you'll notice when you brush your teeth or floss, it starts bleeding. Well, eventually, that bleeding gums leads to other problems from bone loss, which you don't want to have. That's why it's so important to come regularly, have your teeth cleaned every 6 months. Others develop more tartar, so they have to come in more often, so maybe about every 4 months or 3 months.
Now, floss is very important. To me, from what I have heard from many doctors, in some ways, believe it or not, floss might be even more important than brushing your teeth, because what happens, bacteria, food gets caught between your teeth.
Oh, yeah.
And if you don't floss the right way, again, you can have tooth decay, you have bad breath, and also affects your gums. Is that correct?
Yes, well, it's important not only with the gums, but when you floss, you've got to brush or scrape your tongue. You know, it's as simple as taking a spoon, and you don't have to spend anything extravagant like a tongue scraper. Just take a spoon and scrape it. You'll be surprised.
Right. A lot of people have bad breath at different times. Brushing your tongue and upper part of your mouth helps a lot. Would that be true?
Yes, yeah, that's very important. So again, every night, you've got to do it every night.
Now, why is that? Is the tongue that absorbs bacteria?
Well, the tongue is like a carpet, you know. You have the texture of it, so it's so important to just really scrape it all off. That's why.
How about the proper toothpaste? Which one is better than other?
They're all good as long
They're
as
all
you
good.
use them.
Okay, they're all good. But there are some that have
But
some,
well, you know, without naming brands, but you want to use some with antibiotics in them as well. But there are some toothpaste now. Obviously, they're whiteners, so they're good. Just the main thing is diet and keeping proper oral hygiene.
how about gargling, for example, with different type of I don't want to name the label, for example.
Well, in the old days, you just use warm water and salt as a good disinfectant. But now you could use different mouthwashes. Avoid ones with alcohol in it, so you don't want that. Just simply brush and floss.
Okay. Now, people sometimes, instead of dental floss, when they're having lunch, they cannot have toothpaste, toothbrush with them. They use what's called a little bit of Q-tips. Is that good?
A little pick? Well, it's good. It's somewhat better than not doing anything. But you don't want to use. Some of them have those big bristles in between. You don't want to just really stuff those. So that's not good either for your gingival tissue.
But also you should be careful, if I'm correct, when you're using toothpick, not to hurt your gums.
Yes, that's why flossing is the best way.
I see. Now, you also do, as I indicated, comprehensive, not only general dentistry,
we do a lot of.
But you also do
Well,
cosmetic.
we do a lot of cosmetic
Right.
dentistry, from implants to you name it. We've done all. We provide all phases of dentistry. So at our office, we do the oral surgery, we do extraction of the wisdom tooth, root canals, as well as crown and bridges.
Now, a lot of people have fear for several reasons. When they have problem with their teeth or they have gingivitis and so forth,
Yeah.
they don't want to go to the dentist.
Well, the biggest thing is trust.
The trust.
Yes.
Exactly.
Yeah.
Well, you are the top doc, as they say,
Thanks.
in Los Angeles, and I've seen you perform firsthand, so I can attest to the fact that you're really fabulous. And as I also indicated, they can go to smile1.com.
The number one.
That's it, number one, and see exactly what you have
Yes.
done. So if you be so kind, you brought some pictures today.
Yes.
I'd like to show before and after, and if you briefly expand on each one, I would be very
Sure.
grateful. So let us put on the first picture of before, and then Dr. De Los Santos will talk about it.
Oh, she's funny. Well, she's had her share of her dental work, and we're doing implants. And as I told her, you know, it'll take a while. And if you see that after, because I told her it'll take about 5 to 6 months, and I said, okay, this is her after. It changed her so much. She lost weight, the self-esteem, everything. It changes a person's personality. And she, in fact, referred her husband, and we did his teeth, and I think his teeth is here too. And oh no, that's not her.
No, just another one.
But this is another one where she had large gaps in between, and we changed, and we put veneers and crowns on her. There she is.
How long did the process take, Dr. De Los Santos?
2 visits.
2 visits.
Yes.
See. And the next one, please.
Yeah, same with her. She had a lot of crowns from previous, but as we said, you've got to floss, keep them clean, and see your dentist regularly. And in time, we had to take care of them and change them, and this is what we had to do for her.
Next, please.
Big difference. Yes. See, this is why it's so important for oral hygiene. With medication and diet, health problems, health issues, you really got to take care. We can't forget our teeth. And there
Now,
she is after.
now what did cause that? What did cause that?
Just combination from health
Combination of different
problems
things.
and
I
oral
see.
hygiene. Yes.
And that's after. It's amazing.
Now, she had her denture, but because of bone loss, this is what she had. And I said, no, we can improve this. She had this for years, and you'll see that because of the bone loss, we changed it around, and that's what we did for her. Big difference.
I think
Now,
have
we
one
had a
more.
picture. Oh, I don't know if you had another picture from her husband. She was joking because we fixed her teeth. She was so happy with her teeth. She referred her husband and she said, okay, Doc, if he cheats on me, it's your fault. I'm going to blame it on you.
Well, amazing when you see those pictures before and after. It's really like miracle.
Yes, it really changes them, and it gives me a great feeling. It's a good feeling, makes someone happy because
Yeah.
it really changes them as well.
Well, a lot of people always want to have good teeth and proper oral hygiene.
Uh-huh.
And smile is so imperative, and I think today with so much advertisement that's done regarding how to remain beautiful, especially for women who are looking and desires to
Men
be-
as well.
Men as well, of course,
Yes.
but I think women more so are very receptive as to how people look at them. And when they have good teeth, beautiful smile, I mean, you yourself, Dr. Santos, you have fabulous teeth.
Thanks.
Which would be great propaganda.
Well, my mom was a
advertisement.
dentist, so I heard it every day.
Right.
Brush
So
your teeth.
the importance again of visiting dentists. Why is that really important? And how often should they visit the dentist?
Well, with a dental, it's not only just dental. It's great for your overall health. You know, there's a correlation between heart issues, other problems.
Yeah.
So that's why it's so important to keep them clean and visit your dentist regularly.
Yeah, let's talk about that because I've also heard about flossing. If you don't dental floss, it would affect your heart some way. Can you describe that, please?
Well, the flossing just helps, but it's a matter of keeping the whole oral hygiene clean and seeing your dentist regularly.
But I know, but again, about the heart, I know.
Well, because of the buildup, when you have bacteremia running through your system, and all that is in your teeth. For example, if someone has heart problems, they all have to be pre-medicated before we even treat them.
I see. So by dental flossing and regular checkup and maintaining your oral
Yes.
hygiene would affect not only your health, but also your
Yeah,
heart.
there's correlation with all that, yes.
Now, is 6 months the proper timing for the patients to visit?
It
the
varies.
dentist? It
As I
varies.
said, some people develop more, well, first of all, tartar is a byproduct of saliva. That's why a lot of people build up right below here, under your tongue. And when you build up, you just have to come in more often, as others come in every 3 months, others 6 months.
Now, we know that sugar, candy, sodas,
All the carbs, yes.
all the carbs create cavities.
Yes. Well, it's the sugars that eventually form from the breads, the sugars that form acids that attack the enamel. And what seems like a little pinhole, it's actually like a little pyramid. It's a pinhole through the enamel, but once we get in there, it's large and it's like a pyramid. And obviously, when you start sensitivity to hot, you want to avoid root canals. So take care of them while it's still small.
Well, how would people basically really get away from sugar because they have substance such as non-sugar product, for example, they have Sweet and Low,
Yeah.
they have Splenda, but when you are raising children, you really don't want to start them on that type of items.
Well, my kids know. I didn't buy it.
Okay.
But once in a while they could have it at parties. But my friends used to all tease me about just drinking water. But you just have to make sure you drink water after.
Yeah, or brush after.
Yeah, you don't have to, don't deprive yourself. But gradually, when you drink less of it, you won't tolerate as much. You won't drink as much.
But also there's a saying that you should drink approximately 7-8 glasses per day.
8 glasses a day, yes.
And that really helps not only for your teeth, oral hygiene,
your
but it
overall
affects your
health.
Overall,
Yes.
and that's very imperative. Can
Yes.
you expand a little bit as to what it does to other parts of the body?
Well, you have to stay hydrated, just like a plant. You got to keep it hydrated. And our system, just caffeine, for example, drinking coffee, all that dehydrates you, so you have to replenish yourself
Right.
back with water. When you exercise, just little sips of water all the time. You got a little exercise, take a little sip,
But it's also good for your complexion,
Oh, yes,
reduces acne.
everything.
It really does.
Yes.
And it's amazing, a lot of people, for simple things in life, they will avoid it, and then
Yeah,
aftermath,
you've got to drink water.
it costs them so
Yes.
much money. And I'd like to, for a few minutes, go back to your background, if you don't mind. I'd like you tell the viewing audience, for example, where were you born and
Well, I
how?
was born in the Philippines,
Excellent, okay.
and I'm one of four. And in the Philippines, actually, my mom was a dentist there, so it's hard to believe she was a dentist at 21.
Oh, wonderful.
Yes. So when we, from the Philippines, we came here to the United States in California. We took her exam, and my father too was a dentist in the Philippines.
I see.
But he didn't continue here. He had his fire equipment business,
I see.
and
What age were you when you came to the United States?
I was about 8 years old.
8 years old. I see.
So, in fact, a few years ago, my sister and my kids and some friends, we went to the Philippines on a mission trip.
Oh,
Brought my
wonderful.
cousin along as well,
Uh-huh.
and we served over 300 kids.
I see.
It's amazing to see all the kids. They don't have the proper care. So, 2
These-
years in a row, we did it as a volunteer for
Now,
a mission.
These are the children, basically, that under SMILE, many dentists go to different parts of the world who children or people cannot afford.
Yes, there's a lot of different
dentistry.
organizations.
Yeah, can you
that
explain a
does
little bit
that.
about that, please?
For example, through my sister's church, we had done it, and they needed a dentist, and I volunteered. But there's so many organizations around it. We do that, and it's really a pleasure to be involved with it and give back.
You also do work on crime, people who have
Yes.
been abused with crime, for example.
Yes, the state has a program where it's victims of crime, where, for example, either from a car accident or a shooting or anything, someone's been robbed. For example, just the other day, that's what we had. Patient came in. I said, you know what? We can do things for you because he got jumped. And I said, you know, we can do this. We can help you out. And that's what we did. So it's a program that we do help. The state, it's a program that we take care of them.
So this is related to their teeth, right? Or oral hygiene,
Well, it's related to health-wise.
health-wise.
Yeah, even from a car accident. So
I
if
see.
they're involved with a car accident, that's
I know, but
That's what we've
affecting
done.
their
Yes.
mouth, actually, or teeth, right? I see. So you do correction and
yes.
improve their situation.
Yes, we've
Now,
done some where we replace some implants or some teeth and took care of them.
Is there cost involved, or you do it for free of charge? How
Well,
you do
we
that?
get reimbursed through the state.
The state does that.
Yes.
I see. Okay.
But it's up to the individual, and through different access, you can get your teeth done.
I know you're extremely busy with having 3 offices
Mm-hmm.
in different locations. What are some of the things that you like to do when, if you have some time?
Oh, I like to do everything from golf, which I wish I could be better at it, but you know, golf is very humbling. But my kids know we like to enjoy different things from boating to you name it.
I know you have-
summer's here.
You
Yes,
have
we like to
wonderful
exercise a little bit.
children. You have sons that they're active in various sports too, that you're very involved with them.
Yes.
They're involved in baseball.
No, actually football, mainly football and
I see.
golf.
Okay.
So,
Now, tell us something about each offices, basically. When you are not there to be presented yourself, who takes over for you in those different offices, please?
well, fortunately, I have associates that work with me, and when I'm not there, for example, in Los Angeles, when I'm not there, I have my associate that works with me, and we're there open 5 days a week, and same with Long Beach and here in Arcadia.
Reading your website, I found every single person's testimonial was positive, and it was really refreshing to read that. And of course, that comes from satisfied customers having satisfaction by going to the office of each one of your offices.
Yeah.
And the smile that I've seen on so many faces, and the picture is amazing. And that's
Well-
really the key factor when you want to refer someone by saying, I went to Dr. De Los Santos' office, look at me. And that's the most fabulous referral you can ask for.
You know, it's as we said before, it's the best referrals through word of mouth, and like with you referring your wife, etc. It's great.
Right.
And most of them have all been through word of mouth. And one person, no pun intended there, but,
Right.
but everyone's referred from friends. And as we get to see the patients, you know, a lot of them do become friends. Look at us.
Absolutely.
Yes.
Absolutely. Now, one more thing. Again, some patients have a fear of going to the dentist, especially children.
Yes.
Now, you work on a lot of children too.
I do work on children, and if it's really difficult, you know, I would refer them to pedodontists, but most of the time they cooperate.
I see.
Yes.
And what is the parents should really talk to their children about dentists to minimize the fear?
Oh, I tell them, bring them in before they're in pain.
Okay.
You know, I've had some of my friends, their son got so used to coming in watching his brothers that one day he just popped up, sat on a chair, opened his mouth. You know, he got used to it because he was there not because he was in pain, but he knew just for cleaning.
Right.
So that way they don't attribute the pain to me. It's like, no, it's just have them come in and, you know, regular checkup and cleaning.
Right. You mentioned something which is really true, not only parents' role in raising their children properly, but also teaching them about not only proper hygiene of your mouth and teeth, but of course health-wise
Yes.
and many
Proper
other
diet.
things. Right, proper diet. I recall my parents, for example, especially my father, really never ate sweets and talked to us at a young age about brushing. Of course, I came from Iran. There was not too much dental flossing there. But when I came here, I began to do so. And I'm kind of proud. You could probably use me in one of your commercials. I've had only 4 cavities all my life.
I could attest to that.
I still have my wisdom teeth. And I think
Yeah, they're looking good.
good. So it's really important what you said.
Yes.
Yeah. So
It starts
Go
when
ahead,
they're
please.
young. You know, I tell our parents, you know, brush your teeth and then have the kids brush your teeth. You know, that way they know it's give and take.
Another thing that I would like you to expand on, a lot of children get into fights and they don't realize, God forbid, if they have a tooth injury, it can also affect them sometimes for a lifetime because some damages are very difficult to repair.
Oh yeah. Well, unfortunately, they will get in fights, but it's all preventable. On the dental work, we can take care of that stuff. But it just reminded me, and when someone is playing sports, they've got to wear their mouthpiece. You know, I have patients because of basketball, they get an elbow to their mouth. I've got to replace their front teeth. So in all the sports, make sure you wear your mouthpiece. From hockey, basketball, football, all that's important. Even wearing a mouthpiece when you're grinding, it's so important because just the pressure alone will crack or fracture your teeth. And going back to diets, I tell my patients all the time, don't chew ice or don't chew whole almonds. I mean, granted, your physician will tell you almonds are good for you, but the almonds are so hard that when you have large fillings, they'll crack it. So choose the one that are sliced almonds, much better.
Yeah, also, a lot of people, including myself, at times I did it, when they want to, for example, eat pistachios, because the salt tastes good, they put the whole pistachio in the mouth and try to break it.
Oh yeah, all those little things add up. It's usually something hard that cracks it and something soft. Patient will say, well, I was just chewing gum and it broke off.
It doesn't take
No.
much really to crack your tooth.
Yeah, that's
basically.
why avoid chewing ice, things like that.
Now, let's talk about braces. How do parents need to look at their children before finding out they need braces or not?
Well, sometimes you can avoid doing the braces when they're young enough that you can use retainers to correct it. But sometimes when it's too severe, obviously you'll have to have the braces. But you can also use Invisalign. So we have different cases where you can have different ways to straighten your teeth, from Invisalign to retainers. So.
And some people, when they're sleeping, they grind their teeth. What do you recommend about that?
Yes, well, try to relax. When you're grinding, there's some issue there. You're stressed somehow. You know, there's something that's causing it.
But you also basically can give them
Yes, with a mouthpiece as well.
mouthpieces, for example. Now, there's another factor that I've seen in some people, whereas the upper part of their mouth extends out more than the lower one. You can correct that, basically?
Well, depends. Each case is different. Now, it's interesting you mentioned that because some people, when their jaw is a little bit more forward, have a less tendency, because I'm bringing this back because we were talking about the mouthpieces, is now we have, when people snore, we have them wear the mouth appliance, oral appliance, which prevents you from snoring.
I see.
So it actually protrudes the jaw forward. It's an oral appliance because all this can help you. Your dentist can help you. And rather than using the CPAP, we can use an oral device. And what it does, it actually pulls your jaw forward. So when you're laying back and sleeping, the tongue doesn't fall back and causes
I see.
other problems. Because snoring does have other effects too, from heart trouble, everything else.
Now, having good oral hygiene and good teeth has so much benefit from standpoint of how you're able to chew your food properly.
Yes.
People who do not have the
Oh,
proper
yeah.
teeth, they cannot chew. As a result, they swallow their food.
They just swallow their food whole.
And
I had a
the
patient like that.
illness that affects them is really great.
Yes, I had a patient like that. He constantly swallowed his food whole because he wouldn't wear his partial dentures. So we took care of it. He saw his physician. And after we took care of his teeth, his problem slowly went away because he was chewing his food instead of, swallowing it whole.
Let's talk about smoking briefly. I know smoking also damages your gums, and of
Yes.
course, besides having bad breath and not doing for your health, good health, what does it do basically?
Well, that exacerbates the problems with your teeth if you have periodontal problems. If you have bone loss, the smoking, all that really affects it as well. So not only heart and lungs, but also with your dental-wise.
So there's so much
And
basic.
people don't realize the smoking. You mentioned skin earlier.
Right.
It affects your skin. We can tell who's the smokers because of the wrinkles all along the lips.
Yeah, that's something I'm glad you brought it up. A lot of ladies, for example, who go pay thousands of dollars to have cosmetic surgery, they can avoid it somehow from the standpoint of not smoking, for
Yes.
example. And also wrinkles, the facial expressions that we make has a big effect basically.
Yeah, it does.
Well, Dr. De Los Santos, we have really covered a lot of things in
Yeah.
dentistry. I want to thank you so much for coming in.
Well, thank
And
you. It's a pleasure, Nat.
It's my pleasure.
Yeah.
And before we conclude, I'd like to tell the viewing audience, you have heard much about how to maintain good oral hygiene and how to visit your dentist on a regular basis. Now, if I want to recommend, of course, I recommend Dr. De Los Santos because he's truly one of the best doctors you can find anywhere. So regardless of who you go to, please take good care of your mouth, your teeth. You'll have a beautiful smile. Visit your dentist on a regular basis and make sure that next time you have problem, don't wait, it's too late. See a doctor immediately. Thank you
Preventative
so much
scheme.
for tuning in and have a wonderful day.
All right. Thank you. That was